Okay, can I welcome everyone to this, the 22nd meeting of the Public Petitions Committee in 2019. The first and only item on our agenda today is the consideration of continued petitions. The first continued petition for consideration today is Petition 1690 on review of treatment of people with ME in Scotland, lodged by Emma Shorter on behalf of ME Action in Scotland. The petition was last considered in May 2019, and at that meeting the committee agreed to invite the Cabinet Secretary for Health and Sport to give evidence. I'm delighted to welcome the Cabinet Secretary today, as well as Scottish Government officials, Dr Catherine Calderwood, the Chief Medical Officer, and Anita Stewart, the Team Leader for Clinical Priorities. May I invite the Cabinet Secretary to provide a brief opening statement before we move to questions.
Thank you very much, Convener, and good morning to you and to members. As you'll know, Convener, and I'm sure members will have seen, I wrote to the committee in September of this year, so the statement I'm about to make, or the opening statement, in part touches on some of those, but also covers the recently announced and published Neurological Care and Support in Scotland plan. I want to start, though, by reiterating our commitment to ensuring everyone living in Scotland with neurological conditions, including ME, are able to access the best possible care and support and benefit from healthcare services that are safe, effective and person-centred. When I spoke in January, since then there have been a number of developments relevant, I think, to the petition. In March, Healthcare Improvement Scotland published revised general standards for neurological care and support, which we had worked closely in partnership to deliver. These are based on the 2018 Health and Social Standards and represent significant collaboration across statutory bodies, third sector organisations and people with lived experience. The standards stipulate that people should expect to receive the same high-quality service from health and social care organisations that support them, regardless of their condition, their geographical location or individual circumstances. As I've mentioned yesterday, we launched Scotland's first framework for action on neurological care and support. And over the next 5 years, we will work closely with partners, including HIS and NHS Education Scotland and key stakeholders across the neurological community to implement the 17 commitments to improve access to care and support. The framework is not condition specific, but we do recognise ME as a neurological condition. During the development of the framework, we heard from the ME community, both through the lived experience survey led by the Health and Social Care Alliance and the responses to our public consultation. I hope people affected by ME will identify with the framework's 5 aims that include ensuring equitable and timely access to high standards of person-centred care, establishing a sustainable workforce model and improving the coordination of care and support for people with neurological conditions. Underpinning these are commitments set out in the actions we will take. For example, the petition seeks further research on ME, and the neurological framework outlines how we will support the neurological research agenda. As I highlighted in my letter to you in September, the Chief Scientist's Office has been in dialogue with ME research organisations, researchers and various ME third sector groups to explore how we can specifically do this for ME, including opportunities through the existing research we are co-funding at the University of Edinburgh. We've also told ME organisations that we would consider a funding proposal from them to contribute support to the creation of a priority setting partnership through the James Lind Alliance. I understand organisations do see the value in pursuing this. Part of this is also understanding the prevalence of neurological conditions, another area I know the petitioner is keen that we make progress on. So another commitment is to improve the recording of neurological conditions such as ME in people's routine health and care records so they are visible to appropriate services. We've prioritised the continuation of the prevalence work we started with NHS Information Services Division in 2018, recognising that to make progress, we are subject to developments underway, particularly with regard to primary care systems. I still expect progress to be made over the next year. In terms of awareness of the information and resources available on neurological conditions, both for patients and for professionals, we've committed to actions that support shared decision-making and access to supported self-management, building on and learning from existing provision, including peer support networks. My officials have been and will continue to support ME organisations to explore opportunities with NES and other bodies to develop training materials for professionals about ME. This includes understanding the context of undergraduate, postgraduate and continuous development resources generally for neurological conditions. I hope the petitioner will also welcome the focus in the framework that the framework will bring to the testing and evaluation of generic neurology community-based multidisciplinary team models to assess innovative ways of delivering care, including new roles and new arrangements for coordinating care and support for people with neurological conditions. And another relevant commitment is our intention to work with others to develop nationally agreed, regionally and locally applied guidelines for health services and referral pathways. In addition, we will explore the potential of national care frameworks and how these can inform neurological care and support. I know that some of the third sector ME organisations are already considering the potential of an existing framework for another condition and how this might be beneficial to people with ME. We will be mindful when implementing this commitment from the framework to consider how different types of neurological conditions, such as ME, can be represented in this work. Another area of relevance is the commitment to improve the use of digital technology to ensure that integrated services seamlessly meet the needs of people with neurological conditions and those who provide care and support to them. This is an area that has demonstrated how the introduction of technology can make a huge difference to some neurological conditions, and we will be looking to learn from and build on that over the next years. Implementation of the framework and the improvement actions are being informed by quality management, specifically quality planning, control, assurance and improvement that is linked to leadership, learning systems and processes that will promote collaboration with lived experience and people involved with the services. Over the past year, my officials have been in regular communication with the petitioner, Emma Shorter, and ME Action, as well as with healthcare professionals with relevant experience, individuals living with the condition, and other organisations representing those affected by ME. I've already highlighted in my letter to the committee that we've commissioned 2 pieces of work. The first is an updated needs assessment by the Scottish Public Health Network to understand the practices and provision for ME in Scotland, covering adults and children and young people. And the second, a gathering views exercise facilitated by the Scottish Health Council to find out what good care and support would look like for people with lived experience of ME. On advice from ME organisations, we have kept the scope of this second piece of work to adults. When the findings of this work are available next year, and I believe we expect it early in 2020, we will convene a short life group, including those with lived experience and clinicians, to consider what practical steps we can take in Scotland to make a real difference in advance of the draft NICE guideline. This group will consider what can be done ahead of that guideline being available, although I understand that NICE recently provided an update on the timing of its revised guideline on ME, which has postponed the publication of the draft till July and the final version until December 2020. I know this will be disappointing for those already frustrated by the wait, but the reason behind that, I understand, is to take account of the additional work NICE has commissioned on patient experience. In light of the recognised limitations on available clinical evidence and those calling for a greater emphasis on lived experience, I hope this is reassurance that NICE is undertaking a comprehensive review of the latest evidence. So that is why we do not plan at this point to make any changes to the advice contained in the Scottish Good Practice Statement ahead of considering the NICE findings, and this includes guidance about graded exercise therapy and cognitive behaviour therapy. Our previous submissions set out the reason for this, but to summarise, these therapies are reported as being effective for some, but not all. I note that within the submissions you've received from health boards, Many refer specifically to the Scottish Statement, which provides clear information about the appropriateness and the circumstances of using these therapies. We've highlighted the Scottish Statement to health boards when it was introduced, and we would do this again if we update it. In setting all this out, I do appreciate there will be questions about accelerating progress. I recognise and share the frustration behind people's need for change at pace, but I do think it is important to ensure that change is enacted based on appropriate evidence and shared principles to support the co-production of services with those living with ME. So that is why we've invested time to ensure the work we are commissioning is shaped by people with ME and third sector organisations representing them. Convener, I hope that is a helpful opening, and of course we're very happy now to take questions.
Thank you very much for that. In fact, we received from the petition a further submission with questions. I think you have a copy of it there. If we don't manage to cover those, I think we would appreciate the Cabinet Secretary perhaps responding to these questions at a later stage. I think the petitioner would be interested in hearing that, but we will not be able to get through all of that just now, so it was just to flag that up to you. Can I thank you for your statement? I wonder if I can just open just with a very... You did refer to this, but in your letter of the 26th of September, you said that Chief Scientist Office and the Chief Medical Officer were to meet with Action for ME and Professor Ponting in October to discuss progress being made through the current project in biomedical research on ME. I wonder if you can provide an update on the progress in that.
Given the Chief Medical Officer was involved in that, I'm happy to ask her to do that.
Thank you, Convener. I did meet with Dr. Chris Ponting, who has obviously got a long interest in research on ME, and with officials from the Chief Scientist Office and ME Action. So we had a very helpful meeting discussing really where the charity groups and support groups would like to go forward with research. The discussion focused then on this priority setting partnership with the James Lind Alliance. Now that's a very well-known methodology for research prioritisation, where if there are a number of requests for research, those are done through consideration by a group of researchers from outside that specialty to look at how research would be carried out in a prioritised way. So we would support calls for research on ME with people with lived experience and the charities involved in that, and we would, in Scottish Government, enable some funding to the James Lind Alliance to go through that priority setting process. What we need then is for people to come forward with suggestions for that research.
Thanks very much for that. Gail Ross.
Thank you. Good morning, panel. Cabinet Secretary, in terms of raising awareness with ME with the healthcare professionals, you mentioned in your submission that the Scottish Government continues to liaise with NHS Education Scotland to explore opportunities, and you also mentioned that in your opening statement as well. Could you give us an update on the kinds of opportunities that you're referring to? And can you also give us an update about the letter that was sent to Sir Peter Rubins? That had been a year ago now. Do you intend to follow up on that to find out what impact it's had?
So in terms of the work that NES is undertaking, they have a practice-based small group learning membership, which includes GPs, and that group has prioritised ME as a module for NES to produce in 2020-21. They'll do this. Now, their intention was to do this with the timing determined by the new NICE guideline publication, but I understand that they will do some advance work, and given that the draft will appear in July, whilst the final version will be 2020, they'll be able to make progress on the basis of that draft. So that work will be underway from NES, and then what happens when they produce that module, then they make sure that all, particularly GPs and others, are aware of it. And in terms of our work with the boards, then we can back that up by encouraging boards to draw it also to the attention of their relevant clinicians. In terms of the letter to Sir Peter Rubin. He has shared the letter with the heads of the Scottish medical schools. And as you know, curricula at undergraduate level is determined by individual medical schools and quality assured by the GMC. I actually had a meeting with our medical schools yesterday where we were talking about the government's programme for government commitment in terms of a new medical school. But I've undertaken to meet with them again early in the new year to pick up with them a number of other issues, including this, but also in terms of other aspects of the curriculum, widening access and so on. So I'm very happy to update the committee following that further meeting. They are aware of it and are individually giving some consideration to their curriculum, but I'm sure, as you appreciate, there are many demands on their curriculum. It's really in part about some of the training placements that they offer to undergraduate medical students, and then looking at some of the potential training in foundation level students,
Okay,
foundation level graduates.
And as for, I suppose, continual professional development of our medical staff, doctors, etc., I was really concerned to see the evidence from NHS Forth Valley that said that they now see the diagnosis of ME as a historical diagnosis. How can we make sure that actually doctors are diagnosing ME and not other diseases?
Yeah, so this is not uncommon to an extent in terms of neurological conditions, and I'm not sure I'm going to get the phrase right. I had a discussion yesterday with some of our clinical advisors and with colleagues on ADHD, for example. I think that the right phrase, Dr. Calder would correct me if I'm wrong, is neurodiversity. So there are a range of conditions, neurological conditions, and there is a growing understanding amongst our clinicians about that range of conditions.
Secretary, if the Health Board as a whole are not even recognising a diagnosis of ME, then it's not a misdiagnosis, they're just refusing to diagnose it in the first place.
Yeah, and I understand what you're saying, and where I was going was that the particular point amongst many of now publishing the framework for action with all of those who've been involved in it is now to raise that directly through our regular contacts with boards. So that is with chief executives, but it's also with medical directors through Dr. Calderwood's network, and particularly to raise directly with NHS Forth Valley that response that they have given, which is out of line with what we would expect. So we need to understand better from them why they are in that position, but more importantly, how they are going to address that and change it so that we have them in line with all the others. But also at the same time, there is a degree of inconsistency, I'm sure you've picked up, in terms of how our boards respond to this. It's not unusual. It applies else in other areas, but we need to look at where variation is acceptable and where variation is not, and then try and ensure a degree of consistency.
For now, yeah. Thank you.
Maurice Coyle.
Convener. Good morning, Cabinet Secretary. Good morning, the panel. Basically, I note the comments you made, Cabinet Secretary, in your opening statement, but the committee understands that you've spoken to, and obviously referred to this, many stakeholders from the ME community to explore the provision of services and different practices across Scotland. Can you give us an update of where we are on that and the sort of progress that has come out of that?
Sorry,
are they talking about the provision of services and different practices across Scotland? How, in your course of your meeting with stakeholders?
So that is in part
you
why...
sort of generally referred to it earlier on, but I'm just
Yes.
wondering what the progress has been. Have we moved it further, advanced it?
That is in part why I have commissioned those two pieces of work that I referred to towards the end of my statement, involving Scottish Health Council and Public Health, and that is to try and understand what is the detail of various practices across the country and where the variation is. I expect to have the results of those in early 2020, at which point we will look at what the variation is and what we might do about that, so that we have if you like, a core, clear patient pathway in terms of, and which runs alongside what Ms Ross was talking about in terms of the education and awareness in terms of the clinical community.
Ali's comments, yes,
Yeah.
as well. Yeah. No, thank you. I'm happy with that. Thank you.
Thank you, Convener. Good morning, Cabinet Secretary and to the panel. The Chief Medical Officer told the committee in January that the Scottish Government was creating a working group to look at the provision of services. You echoed this in your submission of 30th of January 2019, also and the ongoing work you mentioned in your statement. Yet your latest submission on 26 September 2019, you have stated this group will not start work until early 2020. I wonder if you can explain what seems to be a bit of a delay in the implementation of the Short Life Working Group.
So part of what the Short Life Working Group has to work with are those two pieces of work that I've commissioned, so that they have that evidence on what are the range of services and so on. But I'll ask the CMO to update us on exactly how that group will be formed and the specific work that it is going to look to do.
Thank you. So I think there will be some frustration at that delay, but we are starting from a baseline of very little data. So knowing about the numbers of people who have been diagnosed and also finding out about what we've already described this morning about the level of care that is across our health boards at the moment, or rather the variation in those, in that the provision of the care that's available. So we have been gathering some evidence. We've also written to all of our health boards asking about the education of healthcare practitioners. That was in response to those comments made by NHS Forth Valley. We've had 10 responses out of the 14 health boards, and unfortunately the education of healthcare professionals does seem to vary a lot across our health boards, as I suppose we might have expected given the variation that we've found in other areas. So we've been gathering really information in order to get the working group to be able to set some priorities to start work. We couldn't just produce a group and then decide to get the evidence that was needed. So what we will do is work with that group that will have the stakeholders from people with lived experience, but also from the ME charities, as well as our government officials and healthcare professionals, those providing care from multidisciplinary professions across our health boards. We would then take the data that we do have. One of the next things we will need to do is strengthen the collection of that data, and then take what we have in evidence from the range of pathways of care for patients right through to healthcare professionals' education, and map out how we would make those follow best practice across Scotland, but be consistent in all of our health boards. The NICE guidance is long awaited, as you know. A further delay, I suppose, for good reason, again, capturing evidence from those with lived experience, but that our working group will not be delayed waiting for that guidance, because we already know what work we have to do, as I've outlined. And once the NICE guidance is produced, we then are ready to go. We will have the draft guidance in July.
You mentioned in your opening statement the two pieces of work that the Scottish Government commissioned. Forgive me if I missed this in the statement, but do you have a time scale as to when you expect those pieces of work to finish, the Cabinet Secretary?
So that is the updated needs assessment by Scottish Public Health Network and the Scottish Health Council's work on what good care and support would look like for people with ME. And my expectation is that I will have that next year. I understand it will be early in 2020.
And finally, if I could, just what the Scottish Government have done to ensure that the ME community are kept up to date with the timescale and developments that are currently in progress.
So there have been a number of meetings between my officials and stakeholders in the ME community, and including the petitioner. We'll continue that and keep them up to date. They know all of this that I have all the information I've given you in the statement and the work that's underway, including what Dr. Calderwood has referenced, and the research discussions through the Chief Scientist's Office. So we will continue to keep them up to date as progress is made. And of course, they will be involved in much of this work as we develop it.
Okay. I wonder if I can maybe just reflect on some of the comments being made to us from submissions. I mean, one anonymous submission we got said that this person didn't feel there was any sense of urgency for change to relieve our suffering. I think that's something we've heard from various people. Stuart Brown, in his submission, concludes that ME patients have every reason to believe that the NHS doesn't understand them, doesn't care about them, and has no intention of changing. And obviously these are quite... Do you think... So I wonder if you can maybe respond to that, because these are a theme of the concerns that have been flagged up to us, but also specifically around the issue about the PACE trial. You did say that you thought that the treatments were being offered did suggest that there was benefit from them, but of course one of the contentions from the petition and others is that not only are they not of benefit, and there's no evidence that they're of benefit, but in written circumstances, if they're persisted with, they cause further problems. And Professor Brian Hughes has looked at the methodology on the PACE trial. I mean, I think it's probably beyond this committee to understand a lot of these technical details, specifically about methodology. And I certainly wouldn't want to pretend to be an expert in that, but I wonder what reassurance can you give that these questions are actually being addressed through the NHS. I think the point made by my colleague earlier about health boards themselves now saying, well, there isn't such a thing as ME, the world has moved on. The difference from different health boards must undermine people's confidence. And I wonder, if not to deal with the specifics of these issues that's been flagged up, what reassurance can you give the committee that these concerns will be addressed?
Yeah, so thank you very much for that, Convener, because I think the questions you've asked me are really important for those who are suffering from ME, and actually also really important for our wider clinical community to hear and understand my answer to those. I completely understand the frustration that people feel around what they perceive to be a lack of urgency and pace on this work. I think the core reason behind that is partly what the CMO has already said, what I've said, what you know, and that is we actually need to move with pace on the basis of the data and the evidence that we gather. And that's why the work that we've commissioned is so important, that we will have a significant amount of that in the early part of 2020, why that short life group will then also have the data that the CMO has outlined so that they can begin to look at what is good quality care. I said at the outset that people in these circumstances suffering from ME have as much right as anyone else to high quality, consistent care available across the country. To map out what that looks like, understanding from that what does good look like, piece of work that the Health Council is undertaking is really important, to map out what would be the right patient pathway, if you like, in terms of diagnosis, potential treatment and support. And alongside that, in parallel with that, is the work with the clinical community that Nez is leading, so that people's understanding and awareness of ME as a neurological condition, said it at the start, I want to repeat it, is well understood. All of that sits in the context of this plan and the framework for action. So I think it is important that the community knows they have had a degree of involvement in the construction of this plan along with other stakeholders, that they know that we are very clear that ME is a neurological condition. And therefore, if we have boards who believe that it's a historical matter and the world has moved on, then we need to correct that understanding on the part of those boards. But we also need, through undergraduate, postgraduate and continuous development, to ensure that our clinical community is aware of this and has a degree of understanding about how to distinguish different neurological conditions in the diagnosis that they undertake, and then that there is a consistent pathway delivered across the country, providing the support that people need and are looking for. So all of that is, if you like, the end goal, but to get there, we need to have the better data that we're currently trying to gather in order to map out those steps towards that. The final thing I would say about the GET and the CBT treatments, you know, we've said, and I completely understand, these are controversial treatments. They certainly do not work for everyone. It should not be the case that they are expected to be helpful and effective for everyone with a diagnosis of ME. And I'd state again, and we need to make sure our clinicians understand this, that patients should be the driver in the decisions around the treatment that they are given or that they are prepared to undertake. And when patients are saying, this not only does not work for me, but is positively unhelpful to me, then the clinician's responsibility is to have that conversation and look and see what else might be helpful, which goes beyond perhaps their immediate role into that wider multidisciplinary team. And again, that is part of the work that we need to undertake.
In terms of the PACE trial in NHS Lothian submission, because they resist the critique of it that's provided by ME, and the argument is that you build into your methodology something that will bring a conclusion that the many in the ME community would not accept, which is what you've said around not being expected to have various treatments. And again, I mean, I think this is, you know, it's beyond the capacity of this committee really to get the technical details of that, but I wonder if it's something that the Chief Medical Officer and others would at least look at in terms of concerns about, because if you have a methodology that brings a conclusion, which is then used as an argument against those who are saying it's not working for me, you can see where the problem is. And I don't pretend to know who's right in this, but what I would perhaps be looking for as a commitment would be that you would look at both what the petitioner has said, or those who've had a critique of the PACE trial and the response by NHS Lothian about whether you're ending up with an outcome that's come from something inside the trial. Again, as I said, there's a very robust response from NHS Lothian in this, so but I wonder if it's something that you would at least look at.
Yes, I agree that we'll need to look at that carefully. I think we could write to the committee if I ask Chris Ponting and others to help me look at that PACE trial. I don't find it acceptable in the same way as Cabinet Secretary has said that patients who are reporting that a certain treatment is unhelpful for them and then being encouraged to continue that with no other offer. We have to have partnership with patients and shared decision making with them, and in all trials there will be some patients who benefit and some who do not, and it disturbs me greatly to hear that patients are being forced to continue certain treatments before they would be offered something as an alternative, even when that may be not only unhelpful for them but actually causing them side effects and harm.
Thanks very much for that. Any other questions? No, can I thank you very much for responding to our questions this morning. We have to reflect, I think, on what we've heard. There's an opportunity, obviously, as we've discussed, if there are any other questions that you want to respond to. And on the last point, that would help the reflection of the committee as well. So I think at this point, we would simply be agreeing that we would reflect on what we've heard today. And of course, people will be able to respond to what they've heard today. And we will come to further conclusions in the petition at that stage. And with that, can I thank you very much for your attendance. I appreciate how early you had to be with us this morning, but it really has helped the work of the committee for us to be able to deal with that in that way. And to wish you a happy Christmas. And we'll suspend briefly.
Sorry,
Sure.
can I just say before you do suspend, that in terms of all these questions that the petitioner has submitted on the 17th, we will answer them all and we will copy you as convener into our answer, so you have our responses to all of these as well. And of course, my best wishes to you all for Christmas too.
Thank you. Thank you very much for that. I appreciate that, and we suspend briefly. If I can call the meeting back to order, and we're now dealing with Petition 1711 on first aid training for all primary school children in Scotland. The committee will be taking evidence from the Deputy First Minister and Cabinet Secretary for Education Skills on 3 continued petitions today, and the first of these is on first aid training for all primary school children in Scotland, lodged by Stuart Callison on behalf of St Andrews First Aid. This petition was last considered in June 2019 when the committee agreed to invite the Deputy First Minister and Cabinet Secretary for Education Skills to give evidence. I'm very pleased to welcome the Cabinet Secretary to the meeting today and appreciate how much time you're giving the Public Petitions Committee so late in the year. And can I also welcome his official, Laura Meikle, who's the Head of Support and Wellbeing Unit, and I invite the Cabinet Secretary to provide a brief opening statement before we move on to questions.
Thank you, Convener. Good morning. I welcome the opportunity to be with the committee this morning and to address the 3 petitions on important issues that the committee is considering, and I'm grateful for the opportunity to make an opening statement on the petition to provide first aid training in schools. I'm aware of this petition, familiar with its contents, having both responded to a letter from the committee convener in June this year and having met with the petitioner in person since then. Under Curriculum for Excellence, there are 3 key subject areas which are the responsibility of all staff in schools, namely literacy, numeracy and health and well-being. The provision of first aid training in school would fit under the health and well-being subject area. I think it is vitally important for our children and young people to be given the opportunity to positively engage with health and well-being issues at school, and I recognise that being trained in first aid can help them develop the skills that they may need to respond in an emergency situation. I know that earlier this year all 32 Scottish local authorities made a commitment to provide cardiopulmonary resuscitation training to young people in all secondary schools under their management. I see this as an important strand in Scotland's wider out-of-hospital cardiac arrest strategy. A crucial factor helping someone survive a cardiac arrest is how quickly they can be treated. For every minute that passes before cardiopulmonary resuscitation is given, the chance of surviving falls by 10%. Under the provisions of Curriculum for Excellence, the Scottish Government does not prescribe the content of any licence taught in schools. Therefore, since we have no statutory and mandatory curriculum, it is not my intention to mandate first aid training in schools. I have confirmed this as the Scottish Government's position when I met the petitioner recently. However, we do encourage that first aid training is delivered in Scottish schools as part of the health and wellbeing element of the curriculum. Local authorities and schools currently have the flexibility to provide first aid training in schools if they wish, and it would be for them to decide how best to deliver it, taking into account the needs and priorities of all children and young people in attendance. One such example is the Dinky Doctors programme in Aberdeenshire, where children are being taught first aid using teddy bears in special training sessions. I also am aware of a Scotland-wide tour is planned for 2020 due to the interest that the programme has generated. I recognise from submissions to the committee there are concerns over the capacity of teachers to deliver first aid training to their pupils over and above their existing workloads. The outcome of my recent meeting with the petitioner is that officials at both the Scottish Government and Education Scotland will meet and liaise with the petitioner to decide how best we can recognise these matters, including the possibility of hosting first aid training resources online. Education Scotland's website already hosted material on cardiopulmonary resuscitation before all local authorities agreed to provide training in their schools. In doing this work, I think it's important to be mindful of the actual learning experience of children and young people in schools. This includes treating our learners as individuals with their own interests. And I look forward to discussing the St Andrews First Aid petition on providing first aid training with the committee this morning.
Very much for that, and I think we would welcome the progress that's been made, and the fact that you've already been in dialogue with the petitioner is very useful, I think, in our reflections. I want to ask just a couple of points. The petitioner makes the point that if children and young people gain first aid skills at an early age and within school become lifelong advocates of first aid, which I think goes beyond CPR, and actually I think they make that important point, and that will make a huge difference within their families and the local community. To what extent do you think it happens now? To what extent are we equipping our primary school children with those skills? But I wanted to ask, related to that, one of the points that's made by the petitioner coming of the out-of-hospital cardiac arrest data in your report, that actually it's not just that many people don't have these skills, in particular around CPR, but if you live in a poor community, you're more likely to have cardiac arrest outside hospital, and you're less likely to have somebody that's able to support you. So would you reflect on the possibility, as in what you're taking forward, recognise there's actually an issue here around disadvantaged communities, and would you target support, or would you begin that support within those communities if there was going to be such a rollout? I mean, I think that the figures are quite shocking in just, I suppose, a gap created by disadvantage, more likely to have this, have a problem and less likely to get help. So would you look at targeting on maybe schools within those communities in the first instance?
Let me respond to a number of the points there, Convener. First of all, on the question about the general coverage of this issue within the curriculum, I don't have empirical data that I can share with the committee. We haven't gathered that data. But I think in all honesty, I would have to say that I can't suggest that first aid training will currently be comprehensive within the primary education system. So what I've discussed with the petitioners is the importance of encouraging more of that, because I think first aid training is perfectly compatible with the curriculum, perfectly compatible with the health and well-being issues, and there's some specific issues that arise out of that commitment in relation to the second part of your question, Convener, on areas of deprivation. So there's nothing inherently contradictory here. It's all entirely compatible. What we've got to do is to try to raise awareness and participation in first aid training within schools. And what I hope comes out of the dialogue that I'm now establishing with Education Scotland and with the petitioner, and I also met with the Red Cross along with the St Andrews Society at the time, is the availability of materials and guidance and training which enables the teaching profession to see this as a way of illustrating the curriculum, because schools will be looking at what they have to do individually to ensure they're fulfilling the expectations of the curriculum, particularly the benchmarks. And obviously first aid training will help in that respect. So if we can make the materials more readily available, if we can boost the confidence of staff to be able to undertake this activity, if we can establish some convenient contacts with the St Andrews Society as well, because I think often, as I think we will all be familiar, it is sometimes difficult for organisations to access schools. People have busy lives, so if we can make that contact a bit easier, then perhaps we can, some of the training resources of the organisations who are behind the petition can be drawn into the schools as well, which would perhaps overcome some of the issues of confidence that members of the teaching staff may have. And there are, of course, many examples where external organisations come into our schools to provide specialist input, and I'm very keen to encourage that as part of this exercise. So I hope as a consequence of that dialogue, we get to a position where we've got much more participation than I can record to the committee this morning. On the second part of your question, Convener, about areas of deprivation, I think you make an unarguable case that there is clearly a necessity to make sure that in areas of deprivation we have the capability and the capacity to support individuals where there is the likelihood of a greater incidence of emergency assistance being required. Again, as part of the curriculum, schools have the flexibility to respond to that, although I suspect the particular dimension you raise is perhaps one that we need to reinforce more directly with the education system. But if I look at what schools are undertaking in creating the resilience within young people, particularly, and this is a particular focus I see in schools in general, but particularly in areas of deprivation, where schools are making determined efforts to build the resilience of young people within their communities, I think there is an opportunity to address the issue that you have raised. And I'll certainly reflect on that in the discussions with Education Scotland.
One of the things is that we talk about schools not just because it's in terms, you can argue it's part of the curriculum, but the school is a trusted intermediary. It's a way into communities where you actually have access to young people, and probably uniquely. And while you understand the reservations about teachers, the idea of the school being a host to these provisions, I think would be really useful. I suppose the question that follows from that is, what discussions have there been with communities, health departments across Scottish Government about understanding it may be their role and schools hosting it, so it's not just an educational matter? And is that something that you've looked at?
That would be something that I would see coming out of the dialogue that we're intending to take forward, because I think you're correct, Convener, there are many resources that are available within our society, not just in the organisations who have brought this petition to the committee, but within community health resources and the wider health service, which we can consider for discussion here. Because ultimately the point that you raise is about the approach, the practical effect of early intervention. Can we properly equip young people to be part of a solution in providing the early stage intervention when individuals may face a health difficulty. And if we can do that, then I think we will be contributing towards our wider policy agenda of acting earlier, making the earliest possible intervention and equipping young people with the capacity to be part of that solution.
Okay, thank you very much for that. Maurice Corrie?
Good morning, Cabinet Secretary.
morning.
Good morning, Mr Eagle. In your submission, Cabinet Secretary, to the committee, you said it is up to individual schools and local authorities to decide if they wish to provide first aid training and how best to deliver it. Would you say it's a bit like the curate's egg? Somewhere they have it, somewhere they don't, and some local authorities are clearly embracing what is to incorporate this, but others do not provide any first aid training. You know, why is this in relation to that?
I think I would accept that there will be differential participation around the country. I think a lot of it will depend upon confidence levels with individual members of staff within schools, and also about the expertise to which they have access. And obviously we're asking our teachers to do a lot. They've got to cover a very broad range of different issues within the curriculum, and they themselves exercise their professional judgment as to how best they can fulfil the requirements and the expectations of the curriculum. Every young person has got to reach particular levels in the benchmarks that are stipulated by Her Majesty's Inspector of Education. Those are clearly set out to the teaching profession, and teachers are looking, they have discretion about how do we get young people to those levels of proficiency. Some will choose to do that in a particular way that incorporates first aid training, others will not do so. I hope in my answer to my first answer to the convener, and also my opening remarks, I gave the committee some confidence that we are keen to encourage some progress on this issue through the dialogue between the petitioner and Education Scotland, so that we can essentially make it easier to have access to the materials that can support teaching in this respect, and then also to some of the contacts who may be able to help with the delivery of this education in schools where teachers may feel that they don't have all the skills that they would require to put in place. Because I think, I think not every teacher will feel confident about delivering first aid training, and we have to think of the many things that I ask the teaching profession to do. I'm asking them to do a lot of things, and I have to be careful I don't ask them to do too many things. And there may be external resources they can draw upon to be able to deliver that element of the curriculum.
That's a quick supplementary thing. I absolutely understand what you're saying, Cabinet Secretary, I fully understand that. But I think obviously a consistent approach to the whole issue is obviously important. Bearing in mind what you're saying about how can you implement it, and you're obviously not overbearing on the teachers, where do you see the problem in actually getting that sort of consistent approach?
I think
is there something that's lacking that we need to address?
No, I think that the explanation why first aid training, I can imagine if you've got a teacher who's got sort of wider interests, if they're a volunteer with this, the St Andrews Ambulance, the St Andrews Ambulance Society, that will, they'll be super confident about delivering this in the classroom. We've got lots of teachers who've got lots of special interests, and they bring them into the schools, and they make a tremendous contribution on the basis of that expertise that they're bringing in. But if you're not one of those people, you'll feel a wee bit reticent about delivering first aid training. I can understand that nervousness. Whereas if we can get volunteers from the organisations to come forward to support that effort, or if we can boost the confidence of teachers to be able to deliver it, I think that helps us to address some of the issues that...
How would you persuade those volunteers to come forward?
I would want to see us establishing good contact networks between the organisations and schools. It's a bit like, if you take the model of developing Scotland's young workforce, for example, over the last 5 years, we've prioritised the establishing of greater contacts between schools and the world of work. So today, we've got much better contacts between schools and businesses regularly participating in the lives of schools, which didn't exist systemically pre-2014. Now, it does exist systemically now. And that's a really good thing. And because schools are benefiting from that external input from companies, local employers. Employers are getting the benefit of seeing young people and perhaps identifying potential talent. And there's great career pathways being created out of that. But we had to invest the effort in creating those contacts and those discussions. And it's taken us a number of years for that to bear fruit. But I think as an example, it demonstrates how it can be done.
Thank you.
Gail Ross.
Thank you, Convener. Good morning, both. Yeah, just as a little aside, I think that the suggestion of getting in the Red Cross or outside organisations certainly is not a new one, because that's what happened when I was in primary school. And even though it was kind of more simplified when you're younger, such as how to put somebody in a recovery position or how to put on a triangular bandage, and then as you went into secondary school, it kind of went up a level into how to spot signs of a stroke, etc. So, you know, it has been done, and I'm sure, as the convener said, that they wouldn't need much persuasion to go into individual schools. But can you tell us at the moment, for those teachers that are confident enough to deliver first aid training, what materials are available and how you could see these materials evolving as we go on, if there's any improvements that could be made to what's already available?
Some limited material available through Education Scotland on this question, but what I'm keen to enhance from the discussion between St Andrews First Aid and Education Scotland is the development. And I think St Andrews First Aid have actually got these materials. You know, I think they have quite a lot of proficient material, but it's a case of making sure that's presented in a manageable fashion to the profession. So I'm keen to make sure that we present that material in a fashion that can be of assistance to the teaching profession, and as a consequence boost the capacity and the capability of the teaching profession to take this forward where they judge it to be appropriate to do so.
In secondary schools, where would you see these lessons taking place? Would it be across the curriculum? Would it be a thing for, say, PSE in an update?
Young people have an entitlement up until the end of S3 to a broad general education, which covers 8 curricular areas, the 3 preeminent elements of which are literacy, numeracy and health and well-being. And that clarity was set out by the Chief Inspector of Education in August 2016. So the school system really should be in no doubt that amongst the 8 curricular areas, health and well-being is one of the 3 preeminent areas upon which young people must have strong entitlement up until the end of S3. So it would be within the appropriate PSE elements of health and well-being that young people would have that experience within the secondary sector. Obviously, when young people move into the senior phase, there are, as colleagues will be aware, a very, very broad cross-section of different choices and options available to senior phase pupils. And some of the qualifications that exist, which are different to the qualifications that existed when I was at school, are there for young people to take forward to receive other awards. And we increasingly see young people taking these awards where they may be able to develop skills in first aid that would enable them to acquire a greater degree of skill as a consequence. So I think there's that general entitlement up to the end of S3, and there is then the opportunity for young people to specialise in the senior phase should they choose to do so.
And just quickly on the back of that then, I mean, this is a completely hypothetical situation, but what if you had a cohort of pupils in the broad general education, or well, indeed in any of the secondary school years, that wanted to take forward some kind of qualification or training in first aid, but you didn't have the member of staff in that school that was capable or confident to do that? How would they access that then?
It really depends upon location in many respects, because what increasingly is happening in the senior phase is that schools are working with colleges to make sure they best meet the needs of individual young people. So it's not just a case of what goes on in an individual school. If to take the part of the area that I represent in the city of Perth, there are 4 secondary schools and a college. The 4 secondary schools and the college work on a collaborative timetable. Now, geography is a great help here because nothing is more than a mile away from each other. In the constituency that Ms Ross represents, it's somewhat more challenging geographically. But there should be every endeavour put in place to try to make sure that the aspirations of young people in terms of their curricular choice can be met within the education system. And so it shouldn't necessarily just be viewed as it needs an individual member of staff in a school to be able to deliver that. It might be available in another school, or it may be available through a college. And there are, of course, the opportunities for distance learning, which we are encouraging more and more.
Thank you. Brian Whittle.
Good morning, Cabinet Secretary. Good morning, Ms Meikle. Now, I note the petitioner estimating that to deliver first aid education across Scotland, they note it would cost just £1.36 per pupil. Now, I recognise, of course, Cabinet Secretary, that every penny is a prisoner when it comes to any portfolio, but I think specifically your portfolio. But given the benefits that we've heard such training would bring to children and young people in the wider community, I think you know, Cabinet Secretary, how much you mentioned resilience, and building of empowerment and building confidence and that personal pride, and how learning those kind of skills outside of the classroom can have such an impact inside the classroom. I wonder how the case is being made then to the education system. Why wouldn't you provide this kind of training within the environment?
I think the first thing I'd say, Convener, is to reassure Mr Whittle that the arguments here don't hinge on money. Lots of the arguments I wrestle with hinge on money, but this one doesn't. Fundamentally for me on this question, it's about the question in principle about to what extent do we prescribe in the curriculum, and that's the key point. And we opted as an education system, when we adopted Curriculum for Excellence, to take forward an approach that relies exclusively on teacher professional judgment, so teachers making the judgment about what should be covered in their lessons to satisfy the needs of the curriculum. So I don't want to in any way undermine the flexibility and the flexibility available to teachers and the professional judgment of teachers in that respect. The other point, so that's the key decision-making factor here. But what I want to do is be helpful to try to make it more practical and possible for first aid training to be available in schools, which is why I'm taking the action that I'm taking through dialogue with the petitioner and the discussions with Education Scotland. Because I do recognise that if we make it more practical and tangible for a member of the teaching profession to have access to materials and training to build their confidence and expertise, they'll be more likely to share that with pupils or access the resources that might come in from St Andrews First Aid. So it's about trying to build up that capacity within the system to deliver this, but within the framework of the curriculum that we have designed.
I think that's the idea of being prescriptive in terms of the education system. I fully accept, Cabinet Secretary. I think that's why I said encourage rather than impose. I think really what I was getting to is how do we enhance that? How do we encourage that? How do we make sure that the benefits of this type of approach are recognised? And I suppose I've asked you this question many times, Cabinet Secretary. Would this fall perhaps within the attainment fund? Because I know that schools themselves are always very aware of their own budgets.
I don't. I genuinely don't think that money is the obstacle here, to be honest. And I don't think that, I'm not altogether sure, even if I made available some more money, distinctively for this purpose that it would solve the issue. Where we have to address the issue is about making sure that schools, teachers feel confident enough to be able to undertake this level of training. So I'm very keen to see where we get to in our dialogue with St Andrews First Aid and the British Red Cross, because I think out of that we might be able to create a collaboration which enables us to make the type of progress that I can clearly see the committee is encouraging us to make, and I'm keen to be as helpful as I possibly can be in that respect.
I think that's all our questions. In terms of how we now deal with what has been said, I'm not sure whether the committee agrees, but I suspect they will, that they find very encouraging what the Cabinet Secretary said today, and his commitment to an ongoing dialogue with the petition in particular, but with other organisations that may be able to help. My own sense is, government has made a commitment to that it's not just about education, but an understanding other government aims will be delivered through this, that you have acknowledged the issue around targeting or prioritising, I would argue, areas of deprivation in terms of the gap in terms of skills that would be more needed in poorer communities as well. And I have to say, I'm very encouraged by the fact that there is clearly a plan out of this with the petitioner. In that sense, I feel that perhaps this is an opportunity to close the petition, in recognising that the petitioner is, and St Andrews First Aid and other organisations are working with government on what were the aims of the petition. I don't know if MD wants to add to that, if they got the same sense as I have.
Yes, I think absolutely. I think the Cabinet Secretary has clearly demonstrated that there's a desire and a pathway in which they want to go down, especially with the external organisations and the petitioner. I think that I agree with you that this is probably the petitioner has got everything out of this petition they possibly can at this point. It'll take time for us to roll, so the petitioner is perfectly entitled to come back in a year's time or future if they don't feel the progress has been made. But I'm very encouraged by what the Cabinet Secretary has to say today.
Okay, in that case, I think we'd be agreeing to close the petition, to thank the government for engaging so directly with the petitioners, and I think I would also want to take the opportunity to thank the young volunteers from St Andrews First Aid who made the presentation at a previous session. You're talking about resilience and young people having confidence. They were an absolute model for us of what that might look like, and actually provided a very clear view of a wee bit of investment. That kind of work is going to have huge benefits, not just for the skills in first aid, but actually in developing young people with lots of confidence. So we want to thank them, thank the St Andrews First Aid and the petitioner, and note the point that Brian has made, that it is possible to bring back a petition in similar terms in a year's time, but we would want to thank them for their work and agree to close the petition on that basis. And again, I think underline our recognition the Scottish Government has engaged so positively and directly with the petitioner. And with that, can I suspend briefly to change witnesses? Okay, if I can call the meeting back to order. The next continued petition on our agenda today is Petition 1548 on national guidance on restraint and seclusion in schools, lodged by Beth Morrison. At our last consideration of this petition in November 2019, the committee agreed to invite the Deputy First Minister and Cabinet Secretary for Education Skills to give evidence at a future meeting. And I'm pleased to welcome back the Cabinet Secretary and his official Melanie Lowe, supporting learners team leader at the Scottish Government. Members will be aware of media reports earlier this week which suggested that the Scottish Government is changing its position in relation to restraint and seclusion policy. And I'm sure that the Cabinet Secretary will speak about this further as he provides his brief opening statement before we move to questions. Cabinet Secretary.
Thank you, Convener. I'm grateful for the opportunity to update the committee on the latest developments and on the work that has been taken forward in this area. Since my last appearance in April 2017 and the last time the committee met on the 7th of November, there have been a number of significant developments. Over the last few months, we have made significant progress and have now reached agreement with the Equality and Human Rights Commission and the Children and Young People's Commissioner for Scotland that the Scottish Government will produce new national guidance which will provide a clear human rights-based policy on physical intervention and seclusion in Scottish schools. This will sit within the suite of documents in the Included, Engaged and Involved series that places at its core positive relationships and behaviour and early intervention and prevention to minimise the use of physical intervention and seclusion. This approach has been agreed by the Sagrabis Group, which includes representatives from COSLA, the Association of Directors of Education in Scotland and all of the main teaching unions, and the Equality and Human Rights Commission and the Children and Young People's Commissioner for Scotland. The Commissioner for Young People's report, No Safe Place, made a number of recommendations to the Scottish Government. Whilst the Scottish Government agreed with many of these recommendations, we were unable to agree with them all. In our discussions, it has become clear by listening and engaging with stakeholders that this guidance can be delivered in a way which meets everyone's needs. The guidance we will develop will maintain the position that physical intervention and seclusion should only ever be used as a last resort and should never be used for disciplinary purposes. I am pleased to confirm that we have also reached agreement on the membership of the working group that will develop this national guidance. This ensures that key stakeholders representing a range of perspectives will be able to contribute to its development. As well as reaching this agreement, we have also agreed a timescale for the development, consultation and publication of the guidance. I am pleased to confirm that we anticipate publication of this guidance in January 2021. In order to establish the impact and effectiveness of this guidance, we will conduct a review of its implementation 1 year after publication. This review will be informed by a wide range of evidence and perspectives. Concurrently, we will also work with partners to establish a standard data set for the recording and monitoring of the use of physical intervention and seclusion. This new data set will be used to inform and improve practice across Scotland. I look forward to working together with our key partners to ensure that an effective approach continues to be adopted in Scotland's schools when considering the use of physical intervention and seclusion. This new collaborative approach will provide further clarity and evidence on the use of physical intervention and seclusion, supporting the appropriate use of approaches, further reassurance to parents, and strengthen support for children and young people.
Thank you very much for that. I suppose what I'm interested in testing is what this change actually means. So perhaps I'm testing some of the comments that were given to us at a previous session. You'll be aware that the Commissioner and the Petitioner are both clear that Included, Engaged and Involved Part 2 is a narrow framework of exclusion and behaviour management, and that, quote, is problematic to put the guidance on restraint and seclusion within such a narrow framework. Is it now your position that you're going to take it out of that Included, Engaged and Involved framework? I wonder if you can respond to that.
I don't intend to take it out of that framework, but I do intend to provide a more substantive set of guidance on these questions within the suite of material that is represented by the Included, Engaged and Involved material. Now, if I can explain what I mean by that, Convener, I think what the problem which I think we have been, where we've not been frankly speaking the same language with the petitioners and with the commissioners for some time, is that I have always wanted to make sure that any guidance that we put in place about restraint and seclusion is not apart from, but is very much part of our overall approach on supporting behaviour and supporting the correct approaches to addressing behaviour within our schools. So I don't want restraint and seclusion to be sort of separate from. I want them very much to be part of. But where I don't think we have properly set out our position to the petitioners and the commissioners is that we intended to do that in sufficient detail, with sufficient clarity to address the issues that underpin the petition. So essentially, when I said in my opening remarks that the guidance would sit within a suite of documents in the included, engaged and involved series, I don't want in any way to minimise or trivialise the significance of the guidance that we're about to embark upon. I recognise that we have got to do some substantive work to put in place substantive guidance, but I want that to be within that wider framework about how we support behaviour within our schools, because this is, for me, part of how we fulfil our commitment to all young people in school to enable them to be included, engaged and involved. And there are some particular issues that have to be addressed here in relation to restraint and seclusion, and I want to make sure that's done properly and comprehensively. And I hope I've put in place now the mechanisms that enable us to do that.
Okay. I mean, the argument is that if you place it inside a framework of exclusion and behaviour management, you're not addressing what the Commissioner argued for, which is the Commissioner is of the view that the Scottish Government needs to produce something that addresses restraints in the context of additional support needs, child protection and safeguarding and trauma-informed practice. So it's not about dealing with poor behaviour, and what you're allowed to do is recognising that behaviours are emerging out of the additional support needs of the young person, the trauma that they may be in, and in fact some of the restraints may be creating an even more difficult situation for young people. So to what extent is that view of the Commissioner going to be embedded into the thinking of the Government taking this forward?
Let me be absolutely clear on this, Convener. I want to make sure that we fulfil that expectation of the Commissioner. Now, the approach that I'd also want to reassure you that we are not viewing this, and this is where we have to try to encourage a change in thinking about the coverage of the included, engaged and involved series of materials. I don't want them to be seen as being about behaviour management. I want included, engaged and involved, the series of documents, to be viewed as how we guarantee that young people can be properly included, engaged and involved in our education system. So I don't want them to be seen as documents about behaviour management. I want them to be seen as, I suppose, the guarantees that we give to children and young people about how we can make sure they can be properly and fully included, engaged and involved in our education system. So it's about looking at this from a different perspective, not looking at it from the point of view that that series is about behaviour management, but that this is about how we give very solemn commitments to children and young people about how they can be included, engaged and involved in our education system.
Thanks. Gail Ross.
Thank you, Convener. Good morning again. Cabinet Secretary, we had some really quite distressing evidence at our last session where the petitioner highlighted the data that she'd collected from 430 families across every local authority since June 2017, and that every child involved has a disability. And she states that children have been, and I'll quote, injured, dragged along corridors, held forcefully enough to cause bruises, scratches, abrasions, broken limbs, noses and teeth. Can you give a guarantee to our children and young people that this updated guidance will ensure that this never happens again in schools?
I don't want any of the examples of experience that were cited by the petitioner at the last time the committee looked at these issues to be the experience of children and young people within our schools. I don't want that under any circumstance. School must be a place of safety and reassurance to every child and young person in Scotland. Must be. Young people won't be able to learn effectively if that's not the case, and particularly in addressing some of the issues the convener just put to me about the trauma and disadvantage that young people may have experienced. School must be, for them, whatever else is happening in their life, a place of safety and security and reassurance. So all of the examples that Ms Ross has put to me just now are, in my view, not acceptable. So we have to ensure that practice means that we don't have those experiences. So that the thinking behind the guidance will be heavily influenced by the importance of de-escalation of circumstances, of ensuring that staff are properly trained and equipped to deliver de-escalation approaches. And what I can't say to the committee is that there will never be a circumstance in which there may have to be some form of restraint applied. I can't say that because there may be issues of personal safety for a child or a member of staff involved. So I can't say that to the committee. But what I can say to the committee is that I don't think any of the issues raised with me by Ms Ross are in any way justifiable. So we have to ensure we have good practice in place, and that where, and the words I used earlier in my earlier remarks indicated that the guidance places at its core positive relationships and behaviour and early intervention and prevention. And this is the crucial part, and I chose my words very deliberately, to minimise the use of physical intervention and seclusion. So it's not to say that it won't ever happen, but we have to ensure it is happening, if it has to happen, once all other options have been exhausted and in a safe and appropriate fashion. And a safe and appropriate fashion would not be the words I would choose to describe the examples that Ms Ross put to me.
Okay, thank you. Have you ruled out making the guidance statutory?
This has been one of the issues, the rather fraught issues that we've had to wrestle with, and I've been at pains to explain this to both commissioners, and I'm grateful for the fact that they have accepted the reality of the position that we are in today. I do not have the power currently to make statutory guidance in this area. I simply do not have the power in statute to do that. And the commissioners asked me to make statutory guidance within 6 months. Before I could make statutory guidance, I'd have to have the statutory power to do it in the first place. And I can't do that within 6 months. Members of Parliament know how long it takes us to put statute through. I'd have to put primary legislation through this Parliament to do that. That would take me, from a standing start, at least a year, if not more. And then secondary guidance of a statutory nature would have to follow from that. So we'd be looking at, if we wanted to go down a statutory guidance route, we'd be looking at least the start of that process being 18 months away at the very earliest, and the guidance being probably a year after that. So I'm hoping to have the guidance in place which arises out of good open dialogue involving all relevant stakeholders, including children and young people who have experience in this area, to have that in place by January 2021. Now that's quicker than statutory guidance could be formulated. And I appreciate that statutory guidance has got a different character to the guidance that I'm putting in place. But I have secured the agreement of local government, the Association of Directors of Education and our professional associations to work with us, along with children and young people and the commissioners, to put this guidance in place by January 2021. So I'm trying to move as quickly and as authoritatively as I can in the absence of having statutory power to act in this area. So it's not that I'm unwilling to exercise a statutory power, it's that I don't have the power to exercise.
So how do we ensure that, I suppose, rather than being another document that sits on a shelf gathering dust, that we make sure that all head teachers, staff, everyone that's involved in the schools are aware of it and actually have read it and follow it?
The steps that I'm taking to, I've gone through a very careful set of steps over the course of the last few months to make sure that I could get to the point where I'm in front of the committee today saying that I have got agreement from Scotland's local authorities, I have got agreement from the Association of Directors of Education, I've got agreement from our professional associations representing the teaching profession, and agreement from the commissioners to proceed on this basis. So that gives me the widest possible agreement about doing so. What we then have to make sure is that the guidance is translated into practical effect, that it's the subject of discussion at local level, it's understood within schools, and I know from my experience around schools of it's perfectly possible to get strategic messages in the country across to all of our schools and to have them participating within all of that effort. So we just have to make sure that's the case. And we have, crucially, we have all of the necessary agreement in place to enable us to do that as a consequence of what we've been doing for the last few months.
Can I just follow up on the issue about statutory guidance? At the evidence session with the Commissioner, there was a suggestion at least that there had been advice that the statutory thing wasn't going to be considered, it was off the table. Later in the day, the First Minister said that she wouldn't resist it completely, that it wasn't something that she wouldn't consider. And I hear what you're saying about timing and so on. Are you taking, or is it possible to take steps now to, at least as a fallback position, have that as an option, so that if this doesn't work, you could then move to statutory guidance? What would you need to, have you explored what you need to do now to take that power, so that if in a year and a half's time you realise that actually what looks like a way forward is not going to work, you don't then have to wait another 18 months? Is it possible to do that kind of belt and braces work now?
I think I know what would be involved, because I've obviously taken advice on the statutory position, so I know what statute we would have to put in place to enable this to happen. I suppose the question, and what I've said to the commissioners, is that after the 12-month review of the implementation of the guidance, if we are not seeing changes in practice, then I would consider moving to statutory guidance. I suppose the question that you pose to me, Convener, which I haven't given consideration to, is whether I should just set that train in motion now to essentially secure the statutory power in the possibility that we don't see the guidance being effective at that stage. That's the only thing I could add to the measures that I'm taking forward just now. I haven't given consideration to that point, because what I'd agreed with the commissioners was that we'd work together to get the guidance in place, review it after 12 months with very involved participation to see how the guidance is prevailing, and then consider the statutory question.
The argument is it's going to take too long to do this. Then the logic would be, well, take the power, you don't have to exercise it. And I wonder if that's something you would at least reflect on.
Certainly, I will reflect on that in the light of the question you've put to me, Convener.
Okay,
yes,
thank you. Maurice Corey.
Good morning again, Cabinet Secretary and Mr. Lowe. Basically, in one of the previous evidence sessions, the Commissioner and the Petitioner stated that when staff are using constraint or seclusion, mistakes have been made. And obviously, bearing in mind the question by my colleague Gail Ross just now in issues of what happened with some children, do you regard the importance of proper training and support in these proactive strategies you're talking about, and obviously developing guidance and what have you, but there's obviously an element of support to the teachers and those who are actually handling children?
Yes, I think that there is a significant importance around these questions, and that will be part of the rollout of the guidance that we take forward. I think it's important that we consider this, and this is why I was so keen to ensure that this was part of the suite of documents in the Included, Engaged and Involved series, because they are predicated on the importance of applying de-escalation approaches in all circumstances. And I think that's the culture I want to see prevailing in Scottish education. I think these tense situations of conflict within our schools are best addressed by de-escalation of any of the tensions involved. I think that's better for everybody. It's better for young people, children and young people, because if children and young people are experiencing some of the anxieties that underpinned in the first question the convener put to me this morning, then reacting in a way that does anything other than de-escalate the situation is going to be detrimental to those young people. And equally it applies to members of staff as well. So I'm keen that we have that de-escalation approach that is reflected in our policy thinking and our policy approaches. It needs to be reflected in the training approaches that we take forward as well.
And do you feel that there's enough emphasis being given to this in your thinking and obviously deliberations, Cabinet Secretary, for training and the support in this area? So difficult cases, I understand some cases can be very difficult.
Obviously, yeah, I carry responsibility at a policy level. The operational level is carried by individual local authorities and schools. And that's why I've gone through the steps. It's all very well for me to formulate a policy position. I have to have the operational teams and groups in support of that direction as well. And we've now reached a position where local government, directors of education are entirely supportive of this direction of travel. So are our professional associations, so they can be providing members of staff with the guidance and support that they require to enable them to take forward this agenda. So I am confident that we have all of the ingredients in place to enable us to do that.
So what's the main issues that, say, directors of education or local authorities have come back to you with and say, well, actually, such and such, this is really where the main issue is in trying to get that support and teaching to teachers?
Essentially, the challenge, I think, in our education system is that every teacher needs to be in a position to know how to handle any given circumstance, because it may just emerge in their classroom today. It might never have emerged in their classroom up until tonight before, and it might happen today. And there are over 52,000 teachers in our classrooms today. So the principal issue that is raised with me, and this is why teaching, the whole approach I'm taking is about encouraging continuous professional learning within our teaching profession, because the world is changing around about us. So some of the challenges of the experience of children in our society today results in young people presenting with more complex circumstances and backgrounds than has been the case in the past. And the teaching profession has to be equipped to deal with those issues, and if that results in conflict, to de-escalate that and to have the ability to handle all of these questions. So there will be, that's why there has to be an atmosphere of continuous professional learning within the education profession.
That's fine. And thank you for that. That's a very important point. Thank you, Convener.
Thank you. Brian Whittle.
Thank you, Convener. Thank you again, Cabinet Secretary, for being here, and good morning to Ms Lowe. Can I just say, for Maurice Corey's question, I'm glad to hear and we're talking about support to and training to teachers, having a couple of family members who are involved in both, one as a teacher, one as a support teacher. I do recognise, and I'm sure the Cabinet Secretary also recognises, the pressure situations that we're currently speaking about in terms of that sort of pupil-teacher interaction. But if I could ask specifically, Cabinet Secretary, I think the petitioner was critical of the membership of the Scottish Government Short Life Working Group because it didn't include people with learning disability expertise. And I know the Cabinet Secretary agrees with me that it is important to have that kind of lived experience within a working group. So can I ask, on behalf of the petitioner, why that kind of expertise was not included within the working group?
This is one of the areas where we have benefited from the dialogue that we've had with the commissioners about this question. I've now seen the commissioners at least twice in the last few months, or representatives of the commissioners twice in the last 2 months. And as I've listened to their perspective, I've accepted that we didn't have, in our original approach, sufficient breadth around the table to assist us in that discussion. So I've ensured that there will be lived experience around the table to enable us to hear those voices, and that's how we'll proceed to develop the guidance.
Okay, thank you. I think one of the key elements in terms of developing policy going forward obviously be data gathering and the amount of data that's recorded here. And I think the Commissioner for Children and Young People and the Education Skills Committee have recommended to the Scottish Government and they consider ways to improve data gathering on seclusion and restraint. I wonder whether you would like to comment on that and whether what action you'll be taking to address those issues.
There is quite a lot of data collected on this, but I don't think it's collected in a comparable fashion at local authority level. So we're going to do some work on ensuring that there is compatibility and comparability in that data that is collected, and we will ensure that as part of this agreement that local authorities are fully participating in that approach.
I think just further to that, Cabinet Secretary, I think the petitioner was highlighting that the United Nations Convention on the Rights of the Child recommends that governments should record and monitor all incidents of restraint and seclusion. And I think, given your answer there, Cabinet Secretary, and the Scottish Government has committed to incorporating the UNCRC into domestic law, can you make that commitment to ensure that the data is recorded and monitored in the fashion that you've indicated?
I think the first part of that is about making sure that we've got comparable data across all local authorities, and that's what we will take forward as a consequence of the work that we do here. And then obviously from that, bearing in mind what I said in my introductory remarks, that I wanted to minimise seclusion and restraint, it is important that we properly monitor and interrogate any examples where that is happening, because we don't want to see it happening unless it is an absolute last resort. I think we have to be careful, and this is one of the issues that I have to say does trouble me about the data issue, is about how that data is handled, because there can be, and this is why I can't say to the committee there will never be restraint. I don't think it helps the situation if we almost get to a point of having a league table of, for example, which is the worst local authority for restraint, because there may be a justification for all of those circumstances, however many there are, however much we would like them not to be the case, there may be a justification for them. And I'm not sure that that helps in advancing the objectives that I think we're all interested in here, of minimising the use of restraint if it becomes characterised in that fashion. So I want to make sure the data is available to be interrogated so it can inform good practice, so that we can learn from it, so that we can try to find out ways in which we can minimise it further. I'm not interested in collecting the data so we can have a league table about it and we can make some bodies and organisations feel that somehow, despite the fact they believe they are delivering good practice, and it may be independently verifiable good practice, are somehow subjected to public criticism when it's not warranted. But I accept there's a fine line in all of that. But I think it's only right and proper that I express my unease to the committee on that question.
I think, I would agree with the Cabinet Secretary that it's important that in the way in which the data is recorded and interrogated doesn't cause undue pressure within an environment that's functioning properly. But also, I think you would agree that if the data is recorded properly and utilised properly, it can highlight areas where there are issues. And perhaps where more issues are required.
If I can just place on the record, I have absolutely no issue with what Mr Whittle has just said. I think I agree entirely with that, and that's why we're going to collect it. But I do want the committee to be aware of the unease that I feel about how it could be mishandled if not done in the fashion that Mr Whittle set out.
No, and I think, Cabinet Secretary, you would get agreement on the point you just made. But I think my last point here in terms of data gathering, do you think that then, to ensure that the data is recorded in a fashion that can be properly utilised, do you think that will require investment in terms of some sort of data processing and information technology, IT collaboration platform? Will that require investment in bringing all the local authorities together to be recorded in the fashion that you want it to be recorded?
I don't. We already have the CMAS system, with which the committee will be familiar, which essentially enables recording on a pupil-by-pupil basis around the country. So the major infrastructure is there. It may be that there may be additional elements that we need to consider adding to that as this whole issue develops.
Okay, thank you.
Ross?
Yeah, just a quick supplementary on the back of the data recording. Some of the evidence that we heard told us that the parents and families of the children only found out about what was happening in school when the children came home with physical evidence, such as bruises, etc. Will this data recording system be done in accordance with families, and how are we going to ensure that these families are involved right at the outset instead of waiting until the child comes home before they're involved?
I think there's a pretty fundamental point in that question, which is about school and family dialogue. That I think school and family dialogue should be really very open, and whenever any incident that a school believes a family needs to know about, they should be advised about it. Speaking from personal experience, we off and on get phone calls during the day about things that have gone on as a consequence of the antics of our son and play equipment in the school playground, and which is immediate. So I think good practice tells you that schools should be in contact with parents at the earliest and most appropriate opportunity. I hope also, in terms of the formulation of the guidance, by listening to the voices that I've said we will listen to, we get the perspective that Ms Ross encourages us to have in taking forward this issue.
Thank you.
Okay, I think that's us come to the end of our questions again, and then we need to think about how we now take this forward. My sense is there's been a sense of progress, and I think the petitioner has herself been positive in that. I note that we've had this petition under consideration since February 2015, so we need to reflect on how we might take this forward. I know that there's an independent review into implementation of additional support for learning. I don't know whether that's something that there's a context for this petition now in that regard, as well as the specifics around the progress that's been identified by the Cabinet Secretary. I wonder if members have a suggestion of how we might take this forward.
Yeah, thanks, Convener. Yes, I mean, I think that, through the evidence that we've heard today and the commitment that the Cabinet Secretary has given us on behalf of the government, that a lot of the issues certainly are being addressed. I think that it's still something that needs to be monitored. However, I think that as a committee, we may have taken it to as far as we can. So I think certainly I would like to see it referred on to Education and Skills Committee so that they can keep it open and keep an eye on where this guidance is going and how it pans out.
Okay. And to put it into the context of additional support for learning, and I know that's something that they're looking at. Brian?
I do agree with that. I think the one caveat I'd have to that is to ensure the continued input from petitioners and those with lived experience is crucial to this. So I think, you know, in passing this on to another committee, I think that's something I would like to ensure continues.
That's agreed. We'll be flagging up to the Education Skills Committee that not only were we referring to the petition to them, that we saw it in the context of the review of the implementation of additional support for learning, but that there was a benefit in positive engagement with the petitioner and those who had been involved around this debate, and equally that the government has made a commitment that they may look at what can be done to ensure that if the guidance as it develops isn't effective, there's a means by which it can be put onto a statutory basis. So is that agreed? Agreed. Okay, so we're agreeing that the petition is referred to the Education Skills Committee under Rule 15.6.2 of the Standing Orders, and we will write to the Education Committee in the terms that have been highlighted by members. And obviously we would want to thank both the government for the presentation they made today and to the petitioners for their persistence in pursuing these matters over what has been quite a significant period of time, and we want to thank them for their engagement with the committee. And if we can suspend briefly to allow the witness to leave the table. If I can call a meeting back to order again. And our final continued petition for consideration today is Petition 1596 on In-Care Survivor Service Scotland, lodged by Paul Anderson, James McDermott and Chris Daly. At the last consideration of this petition in September 2019, the committee agreed to take evidence from the Scottish Government. Can I welcome back the Deputy First Minister and Cabinet Secretary for Education and Skills to give evidence alongside Jamie McDougall, Deputy Director, Social Care Support. And can I again invite the Cabinet Secretary to provide a brief opening statement before we move to questions?
Thank you, Convener. I welcome the opportunity to provide assurances to the petitioner and the committee of the Scottish Government's ongoing commitment to providing high-quality, sustainable and person-centred support to all survivors of childhood abuse. Future Pathways provides support to survivors by working closely and successfully with a network of service providers across Scotland. I spent time recently with Future Pathways and with some of the survivors it supports. I appreciate that there have been challenges along the way. However, we have made very good progress in meeting those challenges. What is clear to me is the commitment of the staff of Future Pathways to provide a high-quality service to survivors. At our meeting, the support coordinators emphasised how they work alongside people, and this concept struck a particular chord with me. I will continue to encourage everyone who seeks to support survivors that we should be working collaboratively to ensure that our efforts are focused where they should be on delivering support to survivors of childhood abuse. My officials advise me that we are finalising the details of a contract between Future Pathways and Wellbeing Scotland. The aim of this agreement will be the same as many other agreements that are already in place, to ensure that survivors are able to access the support of their choice. A formal agreement between Future Pathways and Wellbeing Scotland will also improve the process of referrals between both organisations. There are now over 1,200 people registered with Future Pathways, with a steady increase in registrations of approximately 35 per month. This and the feedback from survivors indicates to me that the support provided by Future Pathways is welcomed by survivors. There have, of course, been criticisms from survivors, particularly around waiting lists. I've always been very clear that we must listen carefully to the voices of survivors across the range of actions that the Scottish Government is taking in response to the Action Plan for Justice for Victims of Historic Abuse of Children in Care. That is why I took action to address the issue of waiting lists, and I will continue to listen to feedback from survivors. Let me conclude by assuring the committee that I've heard many encouraging personal stories from survivors on the positive impact that the person-centred rather than service-led approach has made on their lives. The Scottish Government is committed to ensure the support that survivors receive through Future Pathways is the right support for them.
Thank you very much. Can I just ask what you think the difference between person-centred and service-led was? What does that refer to?
I think person-centred is where we listen carefully to the experience of survivors, the circumstances that they are in, and help them to identify what assistance they require to progress. Service-led is where we as a public sector essentially say, we provide this service, that service, and the next service, and hope that those services meet the needs of those individuals. And in my experience, in many aspects of public services that works. In relation to the survivors of historic abuse, I'm less confident that it works, which is why I'm more confident in the person-centred approach, where the support coordinators are able to identify in dialogue with, and that's why I was quite taken by the comment from the support coordinators that they work alongside individuals to help them to gather together the support that they require to allow them to progress.
Is the implication of what you're saying is that the service that was provided by Wellbeing Scotland wasn't person-centred?
No, but I think the comment I'm making is an observation about public services in general, and the difference. It's actually not a comment at all about Wellbeing Scotland. It's a comment about how I think public services tend to be organised, that we decide what it is we are doing and we go out and do it. But in some of the complex experiences of the survivors of historical abuse, I'm not sure that meets their needs.
Because there was a move by the Scottish Government, I think what's called a brokerage model, and actually there were some concerns with people in the system already that that wasn't person-centred, and that some of the argument around the role of Future Pathways, the role provided by Wellbeing Scotland, who I think would argue they were person-centred, were trauma-informed, and would go with somebody on a journey, whatever the holistic supports that perhaps the petitioner has highlighted. Do you accept that there were concerns around that? I mean, you have created the impression that there's a difference between person-centred and service-led. I suppose the argument that I think would be contended by the petitioner was that this petition was prompted by a concern that Wellbeing Scotland wasn't able to continue in its person-centred work from which the petitioner had benefited.
I think that's an entirely fair characterisation of the petitioner's perspective. What I would try to explain is that we listened carefully to survivors, and survivors gave us the strong view that a person-centred approach was the way to proceed, where we essentially, and I think, I'm not sure I understand or could explain the difference between a person-centred model and a brokerage model, because I think they're one and the same thing. Having listened to survivors, we went to procure a service to operate on that person-centred approach. Wellbeing Scotland, in its previous identity, did not tender for that. And the organisations that came together under the umbrella of Future Pathways came together to offer that service. And what I accept that we did was essentially start off saying, well, we've procured this, let's now operate in this model, which obviously created distress amongst people who were using the services of Wellbeing Scotland. Now I've taken the pragmatic decision of essentially financially supporting Wellbeing Scotland to continue to support those with whom they have established relationships, to avoid causing any distress or disruption to the continuity of support that's in place for people that were previously using the services of Wellbeing Scotland and are currently still able to do so.
And we'll go on to deal with the specifics of the relationship between Future Pathways and Wellbeing Scotland in a moment. But it feels to me that some of this is about the decision to establish Future Pathways, having listened to survivors. The implication of that was that your previous support for survivor strategy wasn't person-centred. And I think that's fundamentally not the case, because it came out of the development of a strategy which recognised trauma, lifelong trauma, the way in which that would then need to be supported different ways, and organisations other than Wellbeing Scotland were engaged with that. I'm not sure if, therefore, the concerns that have been expressed by the petitioner are actually being understood by the Scottish Government, because the implication is the new Future Pathways model was a new thing where the people were at the centre of it, when in fact the argument is actually it has changed from being person-centred in a way that was in the past to a model which basically you direct people towards different kinds of services through a brokerage model.
Well, I as I said, Convener, I'm not sure I could explain what difference I think between a brokerage model and a person-centred model, because fundamentally it's about trying to answer the question, how do we assemble the support that an individual survivor needs to help them to progress. And that's always been the policy intention of the government, to try to enable us to create that. Now, if in the process of the procurement method that we took forward, it was suggested or inferred or assumed that there was a change in the direction of our approach, then obviously I hope we've rectified that by the way in which we've acted subsequently.
I think perhaps we would need further explanation of what that change was for, given that in fact a lot of people within the system feel that the change was not something that created perhaps the intention that you've identified. But I wonder if we can just maybe look at some of the questions round. I don't think the discussion is really about how an individual organisation has been treated. But we will look at those questions, but it maybe comes out of that deeper question. But I'll ask Gail to ask her questions.
Thank you, Convener, and good morning again, Cabinet Secretary Jamie. You mentioned that there was a contract in development now. Is that correct? Because we heard that Future Pathways won't refer survivors to Wellbeing Scotland as they were not able to agree a contract. Could you maybe tell us a little bit more about this contract that's in development, please?
So the purpose of the contract is to enable us to ensure that individuals are getting the support that they require. And we have to be clear that, like, I don't think it would be healthy or appropriate for Future Pathways to be supporting an individual and Wellbeing Scotland supporting an individual. I think that would make absolutely no sense whatsoever. So we have to have a certain amount of understanding of who's supporting who to make sure that individuals can get the support they require. As I indicated in my earlier answer to the convener, the Wellbeing Scotland receive financial support from the government, so the Future Pathways, and they should be, between them, be able to meet the demand that there is there within the community.
One of the barriers that we heard about appeared to be the level of personal information that Future Pathways was requesting about survivors, and it seems to be more specific than what was required by Wellbeing Scotland. Do you think it's appropriate that Future Pathways can set higher thresholds for data than the Scottish Government, and why is this? Why do you think they need that level of information?
From what I've seen, I don't think Future Pathways are particularly asking for information that's inappropriate. I think it's essentially basic contact information is what I've seen, and beyond that, yeah, obviously organisations need to have contact information to enable them to undertake their work. So I certainly wouldn't want people to feel put off accessing the service because of the information they had to provide. But from what I've seen, it looks to me to be pretty basic contact information.
Survivors are coming back to us and saying that they feel that the level of information is inappropriate. Would that be something that you would look at?
Certainly happy to look at that, yes. As I say, I met with some survivors recently who are using Future Pathways support. That was not an issue raised with me, and it certainly wasn't raised with me by the support coordinators, who struck me as being devoted to trying to get good outcomes for the individuals concerned.
I think one of the things that has been flagged up, that some survivors aren't comfortable giving postal addresses or access to NHS records, which is the case with Anchor, because they've got concerns about that. And I suppose it's the issue is what's been done with the data.
All organisations, any organisation that holds data on an individual is bound by the requirements of GDPR, so they have to hold that information for a purpose, and they can only use it for particular purposes. So I don't think there's something that is so the onus is on the organisation to act within the law on the handling of any of that information.
But would you accept that, particularly in relation to survivors, there's a lack of trust with organisations that have let them down in the past, or the system has let them down, and so they have an anxiety about being asked for information that they don't want to share? And, you know, for example, Wellbeing Scotland allowed survivors to use, you know, false names until a trust was established. That's not, you know, that if you're dealing with people who have no trust, is it reasonable to ask people for, you said basic data, but the suggestion is that that's been asked for an awful lot more than that? And particularly this question of access to NHS records and so on is something that's been a concern.
I think that certainly I'm advised that Future Pathways allow individuals to use pseudonyms and to just offer basic contact information. I think in relation to further information, that would depend very much on what whether that was relevant or required to provide access to other services.
If you can't access the service so you provide that information and folk have not got the trust to give the information, do you accept that that is a barrier?
I can see that, but what I also see is the energy and the commitment of Future Pathways coordinators to build that trust, because they realise that they cannot properly support and assist individuals without that trust existing.
It shouldn't be it shouldn't be something that has to be done before that initial trust has been built.
I wouldn't see it as being required for that, no.
So that would be something that we could reflect back to Future Pathways then.
Yeah, sure. Happy to do so again.
Brian Whittle?
Good morning to Jim McDougall, and thank you to Cabinet Secretary for hanging in there for so long. Can I just to follow on from that? I think the convener and I did meet with some survivors, and given that what we're talking about here is two different organisations really having, for me it looks like a bit of a power struggle, to be quite honest. But at the centre of this are people with very specific to them issues about care, and just to highlight again that one of the issues was raised to us is this ability to access the services anonymously. And as it currently stands, they can do, correct me if I'm wrong here, but they can do that within Wellbeing Scotland, but they can't do that within Future Pathways. And that is being raised by the care survivors themselves. Would the Cabinet Secretary consider having a look at that? And as I said, again, having a chat with Future Pathways to suggest to them that if care survivors are asking to access initially services anonymously, they have to be able to do that.
I'm certainly happy to look at that question and to raise that with Future Pathways. Yeah, there's no problem with doing that. Yeah. But as I say, I understand that Future Pathways does accept that people can access their services with the use of a pseudonym and with partial contact details. So there is some acknowledgement of that, but I will clarify that position for the committee.
I'm just reporting back to you, Cabinet Secretary, from care survivors that their perception of that is not what you describe. And I think that has to be addressed. Can I ask, Future Pathways have repeatedly highlighted to the committee a commitment was made to that the support which 134 people were receiving from Wellbeing Scotland as of 30th of October 2016 would continue without disruption. And they communicated they did not wish their support arrangements to change. I wonder if that commitment still holds, Cabinet Secretary.
Yes, because I think if I go back to some of what I said to the convener earlier on, we listened to survivors who asked us to ensure there was person-centred support in place, and we went to procure that, as we are obliged to do in terms of public expenditure and public service. And a consortium of organisations came forward, which represents Future Pathways. Wellbeing Scotland did not enter that procurement. So the contract was awarded to Future Pathways to take forward a person-centred model. So essentially we got to a position whereby we fulfilled exactly what Mr Whittle is arguing for, which I agree with, which is we need to put in place person-centred support for individuals. And we procured that, and Future Pathways were contracted to deliver that. Wellbeing Scotland then said to us, but we have these people who we work with who don't want to be disrupted. So they don't want to have to create a new trusting relationship. They've got one with us. They don't want to go somewhere else. Despite the fact that Wellbeing Scotland had not tendered for the contract that we had issued. So I took a pragmatic decision, which was to financially support Wellbeing Scotland to enable them to continue to support the individuals they were working with at that time, and that commitment remains in place. Now, they are in receipt of £200,000 per annum from the government for that service. It might actually be from Future Pathways. No, from the government.
Just as an aside, to tie up any kind of loose ends, were Wellbeing Scotland invited to tender?
Well, it's an open tender. Anyone can come forward to do it.
Wellbeing Scotland didn't want to dispense the discretionary fund, and then they didn't tender.
Well,
I mean, the argument is why the
know.
tendering process was changed, I guess, in essence, from the In-Care Survivors Service Scotland, which worked over 7 years, had a person-centred approach. You could have one person dealing with a whole range of things, and then there was a change, and they put that out to tender. There was nothing inevitable about the Scottish Government having to put it out to tender. It was an active choice, and I think what we lack clarity on is why that was done.
Jim Dougal to say a few words on this.
Thank you. I think something the committee should be aware that in moving from the agreement with Wellbeing Scotland, as was open secret, to the new model, we expanded the model extensively. So,
Expanded in a brokerage model, did it?
Well,
If the model that was developed over 7 years, which came out of the strategy and was effective and was about, and not just Wellbeing Scotland, but with other organisations could have done it as well, which is working with the person and one person doing all of this with them. You didn't actually need, there was not an obligation to move to a brokerage model. There was an active policy decision. And I think what we're lacking clarity on is why that was done and to what extent was the impact of that decision. Was an assessment made on the impact on survivors, which is what the petition is about. They're saying that change in the way in which the service was developed had a direct impact on them as survivors, the ability to access group work, access service over a long period of time, having a person who had a holistic approach, trauma-informed. And I suppose the essence of this is, first of all, why was that change made? And secondly, to what extent was there an assessment on the impact of individual survivors? Because isn't it about it being person-centred? Because the service before, I think you'll agree, was person-centred.
Sure,
so it's really a question of why was that change made?
the change was made because demand was outstripping supply. So we've moved from an arrangement of around £200,000 a year, as was, to something that's in the region of £3 million a year. That gives you a sense of the expanded scale of the operations. As a result of that, there was only one set of organisations that came forward. The reason why a consortium came forward is because when you go to that sense of scale, not one organisation can provide that service. We're now supporting over 1,200 people actively, and as a result of the transition to future pathways and the agreements that Mr Swinney has set out, we're also directly supporting Wellbeing Scotland to continue that support to those individuals. But as a result of the expanded model, Future Pathways has agreements with over 30 organisations in place now, so that when an individual survivor comes forward, not only do they have Wellbeing Scotland to access in terms of the support that Wellbeing Scotland provide, they have the whole range and suite of organisations that we have active agreements in place with. And that's the nature of the contract that we're trying to put in place. What we're trying to do is, as well as the Scottish Government directly grant funding Wellbeing Scotland to continue their support to survivors, we're also looking to put in place the contract with Future Pathways at a set amount so that Wellbeing Scotland have some certainty about who they can employ in order to take the referrals on board. And we're actually very close to actually reaching that agreement. And the reason why there's a difference between what Wellbeing Scotland provide to the Scottish Government is because we're grant funding them for the range of services they provide. We're not interested per se in the details about what happens to every individual. But the agreement between Future Pathways and Wellbeing Scotland is important to understand what happens at an individual basis, because we just need to make sure that we're providing the right support to that individual, not twice or not missing it at all. It's just to know what we're doing over there is the same as what we're doing there, and that's the nature of the agreement. And as I say, we're quite close to actually reaching that agreement.
I mean, I think I hear what you say about expanding the amount of money. The issue is how that money is then directed in terms of the needs of survivors, rather than 30 organisations offering different things. is not necessarily comparable with any kind of organisation that can provide coherent individual support for as long as they need it in a range of different ways. But we're not going to resolve that today. Forgive me, Brian, for interrupting you, but can you? I'll go back to you.
I forgive you, Convener. But to follow on from what the Convener said, I think where I would like to go with this is the fact that you know, I think we welcome the fact that you expanded the service, but you had a long, successful working relationship with Wellbeing Scotland. Why not take that model and expand that model with Wellbeing Scotland? Because with the greatest respect, what we are hearing in evidence is there is a power struggle here, and which is obviously going to be detrimental to those survivors who require a service.
Well, I think the question of scale is a very material one. That if you know, it might not be possible for an organisation like Wellbeing Scotland to support the number of
Cabinet Secretary.
Well, we did by inviting people to tender, and they didn't tender. I can't force people to tender.
Tender asked for. I mean, I don't think anybody was suggesting that Wellbeing Scotland would do all of this work themselves. It was the old In-Care Survivors Scotland service, which doesn't need to be just one organisation, I presume, who delivers it. If the argument from Wellbeing Scotland is they were precluded because of what the tender asked them to do, then you can't then say, well, if you didn't tender, there's nothing we can do about that.
Well, but we can't have. But Convener, what I'm trying to say is that I'm agreeing with the committee that person-centred support is the consistent element in all of this, and we offered a contract to provide person-centred support, which the committee suggests to me Wellbeing Scotland were providing, which I accept. But if Wellbeing Scotland decide not to tender for that, I can't oblige them to do that. Now, what I've done subsequent is I've pragmatically accepted the fact that Wellbeing Scotland have got existing relationships with survivors, and I have financially supported those to provide continuity, because what I'm interested in doing is in providing support for survivors. I'm not interested in a power struggle, not the slightest bit interested in a power struggle. Don't care if there's a power struggle going on. What I'm interested in is, are survivors getting the support they require? And whilst I accept that there would have been a risk that people would have had interruption to their service if I had required all Wellbeing Scotland clients to transfer to future pathways, I accept that would have been disruptive, but I didn't do that. I allowed them to carry on with financial support from the government directly to the tune of £200,000 per annum, while we're also providing, in relation to financial support to future pathways, £3.7 million. So I don't understand. So I don't understand. I'm a wee bit lost to understand what the issue is here, because people are getting the support. I want people to get the support they require. We've had to substantially expand the service, and we've let a contract to do that. Wellbeing Scotland didn't tender for it, and I've put the money in place to enable Wellbeing Scotland to continue to provide services to those they were supporting. And all we're trying to establish just now in the relationship between Future Pathways and Wellbeing Scotland is that both organisations are not supporting the same individuals, because that would make no sense whatsoever if we believe in focusing support on each individual.
If I could then, Cabinet Secretary, what I'm saying to you is that in the evidence that we've gathered from both organisations, from care survivors, is that a strained relationship between the two, given that Wellbeing Scotland rely on Future Pathways to give them the support that they need in terms of referring. What we're saying to you, Cabinet Secretary, is that the person-centred care that we all want to happen is not necessarily happening for all. And in fact, we understand that Wellbeing Scotland have no confirmation of funding beyond March 2020. And if that's the case, if they're, the people that they are currently supporting recognise that the Wellbeing Scotland service will perhaps stop in 2020, you would then probably recognise there's an anxiety among care survivors in that they might have to change the service. I mean, do you recognise that, Cabinet Secretary?
I think the issue with funding is that obviously there's we don't yet have a budget for beyond March 2020 in any part of the public sector. So there are obviously issues about funding.
The organisation has been given confirmation of funding beyond March 2020.
I'm simply saying that it's an
the
issue.
fundamental question is it not possible for you to give them confirmation?
I'm coming on to this, and the government is, because of the delay to the budget, the government is looking at what clarity we need to give to organisations to enable them to operate functionally and effectively. And this is not just about Wellbeing Scotland, this is about countless organisations that would have expected to have some funding clarity by now. And the government is in the process of looking at those questions and providing reassurance to organisations, and we will do that in due course.
Cabinet Secretary, with all due respect, I think you know full well that your budget's certainly not going to go down. So there's no. So I think that's a very moot point. The fact of the matter is, Wellbeing Scotland currently don't have any funding beyond clarification beyond 2020. Future Pathways do. So what we're looking for here is, if we are looking at person-centred support here, there are people being supported by Wellbeing Scotland currently who are concerned that their support will stop in March 2020.
I'll take that as shall we and clarify it.
Okay, Maurice Corrie.
Cabinet Secretary, good morning again, and to Mr McDougall. Are you comfortable with the decision that you've taken, obviously, to substantially increase the cost of the public purse instead of using the existing capacity that Wellbeing Scotland could have given? Because they've stated that, and explained to the committee themselves, that had the Future Pathways referred survivors to them, they would have been able to help eradicate their waiting list earlier this year.
I am very comfortable with the decisions that we've taken, yes.
Right, okay, that's fine. And can you explain to us how Cabinet Secretary, how the future pathways are being, will be evaluated in relation to the work that they're providing to you, and what will be considered a success in relation to future pathways now you've taken that decision?
I think fundamentally we have to consider the outcomes that are achieved for individuals. I think that's the fundamental judgment that has to be applied on the work of Future Pathways and also Wellbeing Scotland. What are the outcomes that have been achieved for individuals? What is the, what is the, how are they being helped as a consequence of the services that are in place and the support that's being offered?
Have you got a feel of how it's going so far?
I think there are some very good outcomes being achieved. There are some people who have used Future Pathways services that are no longer using them because they are feeling well supported within their community. They feel as if they've been assisted. They are, for example, in the 1,273 people who were registered with Future Pathways in November 2019, 317 were not actively using the service at that time, but are able to essentially utilise the service should they feel the necessity to do so. So they're not.
Sorry, were they getting a better result by using Future Pathways rather than Wellbeing Scotland now?
I don't have comparable data.
Thinking about the 327 or so that haven't used it.
I don't have comparable data between Wellbeing Scotland and Future Pathways.
Okay, thank you, Convener.
Okay, I wonder if I can ask just a wee bit about some anecdotal evidence we've had about payments from the discretionary fund. Are you confident that there's an effective process in place to evaluate these requests? We've heard of people, for example, receiving quite significant appliances or whatever, who are then struggling to pay their rent and bills and sometimes end up having these items repossessed. Are you tracking this?
I certainly would want there to be effective judgment in place about the commitments being made under the discretionary fund. It's a matter of I think we rely heavily on the judgment of support coordinators about what, in dialogue with a survivor, is going to assist that survivor to be able to make the progress that we would want all individuals to make. That is a fine judgment. It's not precise science. Some of these decisions will not be the correct decisions. I think I have to accept that that will be the case. But obviously, we will be considering the effectiveness of discretionary fund interventions as part of the work that I cited to Mr Corrie about assessing the outcomes that are achieved by individuals.
Okay, you want to ask 7?
Right, no problem. In relation to the survivors of abuse, Cabinet Secretary, to what extent is the Scottish Government engaging with survivors in relation to that?
We have a range of different engagements with survivors of abuse. At a personal level, I see individuals quite frequently. The Interaction Review Group has survivors on it. I think it's vital that we hear the lived experience of survivors, and the venture. I recently chaired the National Steering Group on trauma training. That group includes survivors of abuse on it, and so we're trying to hear that voice consistently across the different policy interventions of government.
What expertise is there within the Scottish Government in understanding the sort of complex trauma sort of issues and the needs of the survivors? And obviously you've talked about how they're engaging, the government's engaging obviously with people who've experienced this.
Look, we have obviously we have professional civil servants who build expertise in a variety of different areas, but that's supplemented by a range of advisory groups that we have. I mentioned there the National Steering Group on Trauma Training, and that brings together a whole range of different interested parties and those with lived experience to ensure that our steps and our policies and our processes are informed by that lived experience. So we have to be always conscious of the importance of hearing those voices and ensuring that we act upon them.
And also that you're imparting training to your officials in relation to that. Obviously, you talk continuous or CPD training, but I mean, obviously, having worked with these care survivors, that it's obviously that your officials will benefit from that, and therefore, hopefully, sharpen the skills even further.
And there's obviously training available to our officials through different organisations that enable them to be trauma informed. There's a lot of work going on within government right across the board on ensuring there is a wide understanding of the impact of adverse childhood experiences, and that is reflected across a whole range of different aspects of the government's policy agenda.
Thank you.
Can I just clarify the circumstances where a survivor doesn't consent to the data being shared? They therefore can't register with Future Pathways and therefore can't be referred to Wellbeing Scotland. Is that a concern to you? That because of where the contract is, people can't access the services they would like to have?
I think the key point for me is an individual, does an individual wish to access some degree of support? And if they do that, I can't see how we can do that without having holding some basic information on that individual. So that would not stop them gaining access to the support that would be available under Future Pathways. I think if somebody was unwilling to give any form of contact details, I'd have to check with Future Pathways if that's their experience, that they have that. But if that, I can't see how... Scotland
they could, and Wellbeing Scotland is thoroughly audited. It's not as if they've got pretend clients who don't really exist. They actually exist, and they have managed a system where they build trust and they get more information. But if a survivor, by the nature of their experience, is reluctant to give more than, I think, what you call basic evidence, basic data, and it's perceived as being more than the basic data that might have been given in the past, they're being excluded from services from which they would benefit, would you accept that that's a problem?
Well, I'm advised that future pathways require a name and contact details, but this can be a pseudonym and partial contact details. So I don't see what's different about that to Wellbeing Scotland.
But would you accept if a survivor thinks it is different, there is a problem? If they don't, we're working on an assumption that folk who want to have support, have been getting support, now feel they can't access that support, or because people feel reluctant to provide the level of evidence or data that's been asked of them, unless they're imagining things that is different from the data that was asked from before.
There's nobody that was getting support can't now get support because of this issue. They can't.
But Wellbeing Scotland can't have referrals because people can't register with future pathways because there is a perception that the level of data that's required of them is higher or greater or more substantial or more significant than it was in the past. Can I ask, maybe it would be easier, given the time constraints we've got, and I appreciate there's a lot here,
for a moment,
is it something that you could clarify for us?
Well, I could tell the committee that there were 171 new referrals from future pathways to Wellbeing Scotland between October 2019 and October 2019. October 2018 and October 2019. So I don't understand the point that's been put to me, because there's referrals been able to be made.
Presumably by people who have accepted giving that level of data, but this is a point that's been made to us.
But I don't know, I don't understand.
Maybe it'd be easier for us to try and establish, or for the Scottish Government to establish, why there are these concerns. I understand this has been something that's been flagged up already. If it were so reasonable and nothing has changed, why would anybody raise it as an issue?
Well, if the committee wants to furnish me with the detail of what the issue is, I'll have it explored. But I don't, on the basis of the fact there's 171 new referrals in 12 months from future pathways to Wellbeing Scotland, I'm not sure I understand what the problem is. But I'm happy if the committee wants to write to me about that. I'm happy to.
But you would accept it is a problem if a survivor is saying it's a problem?
Well, I'd like to see the detail about it, so I can't comment. I've tried my best to deal with this.
Okay. I mean, I guess from the point of view of the Petitions Committee, we're presenting something to you as a concern. It's not that, it's not that we're trying to find a way to ask a question you haven't got an answer to. If somebody says the level of data that's now required is different from that before, and it's an inhibitor to somebody accessing services, I'm sure you would agree with me that that's a problem.
Well, I'd like to see the detail of that, because I don't understand how that can be a problem for somebody who previously used services, because I have taken the pragmatic decision to continue to support Wellbeing Scotland, so existing clients can get their support from Wellbeing Scotland. None of that has changed.
But it may be an implication for future applicants.
And 171 new referrals have been made from future pathways to Wellbeing Scotland in the period between October 2018 and October 2019.
I think if I could clarify where I'm coming from here is that it's not about the 171. What the concern is if there are others who have not been able to be referred to because of this particular issue. And it's not trying to catch anybody out. These are things that have been reported to the committee that we are passing on to you, Cabinet Secretary.
And I'm saying I'm interested in, and I've said it throughout my evidence session here on this item, that I'm very keen for any survivor of historic abuse to get the support that they require. And I don't think, unless I'm prepared to go and look at the data requirements of future pathways, but I'm advised that they require a name and a contact details, and a pseudonym and partial contact details will be acceptable. And because people have got to, the organisation's got to be able to get in touch with people. They've got to know who they're dealing with. And we've also, and
everybody would know that. I mean, I think the idea that people are resisting access to services because that they're not giving very basic data, and I think there's an issue here, which, you know, it may be in the nature of somebody who's a survivor. One of the things that's been flagged up to us is that the new referrals that Wellbeing Scotland have received have in fact not been for counselling, but for finding records. So the question of, I think it's Anchor that asks for access to NHS records, so people can't access that service. These are all kind of bound up together. We're not going to resolve this in little, you know, I appreciate how much time you've already given us, Cabinet Secretary. We're not going to deal with all of the detail of this now, but I would ask that you would recognise that this has been an issue that's been raised as a serious concern, and it may be difficult to understand what it is, but what I would look for is a commitment from you that you would at least look at this as something that's a serious issue for people.
Well, there's a number of very, very specific points have been put to me in the latter part of this evidence session, which I have to say were of a level of detail which I simply don't have in front of me today. So if the committee wishes to send me a letter which sets out these detailed points, I will have them addressed. Because my fundamental point is that I want survivors of historic abuse to be able to access services, and I think the government has substantively expanded the ability to do so. But if there are impediments to how people are able to access those services, I will want to consider how that might be addressed.
Yeah. I mean, I think appreciate that very much. Just to flag up to you on the request for information from Future Pathways, it does say, please tick this box to give permission for Future Pathways to collect and securely store personal information, including sensitive information that you provide, which is necessary for coordinating the services you may wish to access. No service can be provided without this box being ticked. That's the question. And I think that your suggestion that we write to you with the detail around this and get a response from you would be extremely helpful. I mean, my last question, I think, perhaps just reflects what we've been wrestling with today and over a period of time. There is, I think, you would accept some significant concerns from some survivors, adult survivors, about the support that's been provided. And I wonder how, if there is the sense of perhaps a breakdown of confidence, how do you see, or what would be a way forward in terms of possible solution to address the issues raised by the petition? Because even if these are concerns that, you know, Future Pathways don't recognise, and it may be entirely fair for them not to recognise them, the matter still has to be resolved because it is a matter of confidence and trust in the organisation.
I think the Future Pathways are obviously supporting a large number of people. So there are, I think it's just a matter of fact, that there are lots of people out there who are getting support from Future Pathways. That's the first point I'd make. The second is that, you know, I've sat down with support coordinators, and I have to say I found them a really, you know, a wonderful group of people who are deeply engaged in providing support to individuals. I found them hugely impressive and highly motivated, and I thought they were a credit to the organisation. So I would obviously want as many people as possible to be able to have access to that support, because I thought it was of enormous value to individuals, and I heard that from survivors as well. Now, so I don't accept that there's a breakdown of trust, because people are quite clearly using the service and using it in abundance. So there must be a lot of people trust the organisation for what it does. So but also, as I said earlier on, I accept that there are tensions between some of these organisations, and if there are specific issues the committee wishes me to consider to try to address some of these issues, I will happily consider them. But I think we should recognise that there are a large number of people who are benefiting significantly from the excellent support that Future Pathways offers.
Yeah, I mean, I think that the committee would certainly agree that those absolutely in the front line inside Future Pathways and as in other organisations will be doing a really important job. We know that we have heard that for some survivors, maybe many survivors, it's been a very positive experience. But it's also the case, and that, you know, people can work extremely well, even though the structure round about them is one that can be challenging. But there are people who continue to be concerned. I don't think it's about tensions between organisations, frankly. I think it's about whether a service that was provided for survivors in the past will be available in the same kind of way in the future, and that's really what the petition, I think, was exploring. So in terms of taking it forward, I hear what you say, but we will obviously want to write to you about some of the issues that have been flagged up. Indeed, I think the petitioner acknowledges the help that he's had from his coordinator. I suppose the question is, how do we get to those people who are not able to engage because of the way in which the structure operates, who are not, in a sense, excluding themselves because of things that have been asked from them. In terms of the committee taking it forward, I think we're agreeing that we would write further to the Cabinet Secretary. We very much appreciate the time that he's taken over this. This will afford an opportunity, obviously, for others to respond to this evidence session, and we may hear from others who are engaged with it, and we will, at a future meeting, obviously reflect on the very substantial evidence we've heard today. Is that agreed? Agreed. Brian?
The Cabinet Secretary's completely correct, and what our interest lies is that the sort of adult survivors of abuse are getting the support they require with the easiest access possible. I think, you know, I think we've made some progress today, but I still think there's quite a bit of discrepancy in the evidence that we're getting here, and without question, to me, there still seems to be this power struggle, and my concern is that it is affecting the service that is being delivered. So, you know, I think there's. You're right, Convener. I think there are some things that perhaps that we can write to the Cabinet Secretary, and he can consider and perhaps report back to us on, because to me the solution to this doesn't seem that far away, and it almost feels like we want to get a couple of people in a room together and knock their heads, quite frankly, to get back to that person-centred approach that the Cabinet Secretary has indicated is so important.
I think it's, I don't, just for the record, I don't think there's any need to get back to a person-centred approach. I think there is a person-centred approach there. But obviously, if there are issues that the committee wishes me to explore further, I will explore them to try to reassure the committee.
I guess the question is, and we've got 30 seconds left, is whether the changes in the way in which services were procured has created a challenge for some survivors in terms of the way in which that service is delivered. And I think that's what has been explored. Can I thank you very much, Cabinet Secretary, for your attendance today and the seriousness with which you've addressed all of these petitions, and certainly with two of them, I think have been extremely helpful and able to progress matters, and there remain some challenges with these ones, but I do genuinely appreciate, given the scale of the pressure on you in terms of your much broader responsibility, to spend this amount of time with the Public Petitions Committee is very much appreciated. So we're reaching the very end. I want to thank everyone in this committee for making, I think, what has been really an excellent year for the Public Petitions Committee. We've gone through a lot of business, and I think we have a particular role in being outward facing and responding to the huge range of concerns and interests of petitioners. And I want to thank everybody for their personal support, and the Clarkin team as well, and to wish everybody a very happy Christmas and all the very best for 2020. Our first meeting after Christmas will be on 16th of January, and with that, I wish you all the best and close the meeting.